As we know that the World Malaria Day is normally commemorated on the 25th of April of each year. And we are doing the belated malaria commemoration here in Khorixas. The main aim is actually to raise awareness among the public about malaria, that malaria is still with us. It is a stubborn disease, very complex, but it causes untold suffering to individuals and even loss of life. And therefore, our commemoration is really to enhance the awareness about this disease so that everybody can take the necessary actions to prevent illnesses and deaths.
So, Dr. Shangula, how does the global theme of advancing health equity, gender equality, and human rights relate to malaria control and elimination efforts in Namibia?
Well, malaria disproportionately affects people who are poor. And poverty is a result of inequities in the distribution of resources. And that also affects the individual's human rights. Therefore, all the three components, they are intertwined. And when we eradicate poverty, it means that everybody has a fair chance of accessing information related to malaria. It's got a fair chance to be able to access the medical treatment which is available, and therefore it enhances individuals' human rights. So the theme is quite relevant, is topical, and it speaks to what we all desire to have, an equitable society where everybody gets the same treatment in terms of access to information and also how to prevent themselves when they are empowered with the information.
Mm-hmm. Now, that is the global theme. Can you explain the significance then of the national theme, which is ensuring safe communities with zero malaria, and how will it be addressed during this event?
Yes, let me just explain that what malaria is. Malaria is actually a disease which is caused by a parasite, and that parasite is transmitted from an individual with a plasmodium parasite to a healthy person. The basic principles is really to ensure that there is a barrier method. A barrier method meaning that there is no direct contact between a healthy person and an infected mosquito. So once that has been achieved, then it means that one of the important legs has been broken. And secondly, is the source reduction. So the reservoir of the parasite is an infected person. Now, when the mosquito bites an infected person with parasites, it sucks the parasite, and then when it's going to bite a healthy person, then it transmits those parasites into a healthy person. Now, when we talk about source reduction, it means people who have got malaria parasite must be treated, must be cured, so that even if a mosquito bites that individual, will not be in a position to suck out the parasite in order to be able to transmit to another person.
Mm-hmm. So, Dr. Shangula, how can community members and stakeholders get involved in the fight against malaria, and what role should they play in achieving the goal of zero malaria?
In the first instance, the community must have the information. They must have information about malaria, how it's being transmitted from individual to another individual. Now, community has a big role to play. When we are controlling malaria, we are actually instituting interventions in the first place aimed at prevention. Now, we use insecticide residual spraying. That is the program which I'm going to launch today here in Khorixas, the beginning of the spraying period for 2024. Now, the mosquitoes reside in the homestead of families. And then some community, they have a role to play because they can work together with our health workers who are coming to spray and do not refuse them entry into their homestead so that mosquito can be killed. And secondly, we are also informing the public that you can also use insecticide-treated bed nets. In other words, when you sleep, you are sleeping under the net, and this is one of the barrier methods that a mosquito will not be able to reach you because of the net which covers you. So this entirely depends on individual, on community, to ensure that when they buy their bed nets or when they are given bed nets, they must sleep under the bed and also sleep properly, that there is no hole where a mosquito can go through to reach the body of the individuals. There are also many other measures which an individual can take. For example, not being exposed to mosquito bites, especially in the evening when people are outdoors. To ensure that the whole body is covered, long trousers, socks on the feet, and also long sleeves. That will ensure that mosquito will not be able to have access to the individual's body. There are also some other methods like using insect repellents. So once we institute all these measures, then we are preventing individuals from being bitten by mosquitoes. And if this is achieved, then it means there will be zero malaria transmission. And this entirely depends on the cooperation of the public. Of course, the health facility has a role to play in making sure that all this information is available, but at the same time also, when a person is infected with the malaria parasite, immediately and promptly get to the health facility so that the body can be treated and be cleared of the parasite. As I mentioned earlier, even in the event that a mosquito bites that individual who has no parasite, the mosquito will not be able to transmit the infection to another person. That is why we are talking about zero malaria transmission.